Thanks very much, and thanks very much to Jeff and the school for asking me to speak. As Jeff has explained, I work for the charity Place2Be, and we just started working in partnership with Forest School. Today I'm going to talk more broadly about what to think about when approaching developing a whole school mental health service in schools and what we mean by that. I'm going to use Place2Be as a case study on a couple of slides, but hopefully it will kind of address the issue more generally. It's great that lots of you have already got counselling provision of a sort in your school. So I'll go through some slides and then there'll be time for just a few questions and a bit of discussion possibly at the end. And so just to say, because I don't actually have a slide introducing the organisation, as a charity we've been going for about 22 years now. We provide direct counselling services and a wider kind of mental health support in nearly 300 schools, and that includes primary, secondary, state, independent, across England, Scotland and Wales, and quite a number of them are in London. Okay, so the first slide is just a little bit about the need. I think everyone here today will know that in schools you will come across a varying degree, but absolutely a kind of a need amongst the children you work with in regards to emotional well-being and mental health. There's a few statistics taken from the Centre of Mental Health here. You're probably used to statistics like 1 in 5 children will experience a mental health difficulty at least once during the first 11 years of life. The next 3 or 4, so the fact that 2 million children live in a household with a parent who has a mental illness, 1 million children live with a problem drinker as a parent, up to 35% of children report being physically abused in childhood, and 1/3 of children report being bullied at least once. When I was looking at them, they made me think already about how we're dealing with a much broader range of questions than just children's mental health and just counselling. So when you think about the fact that there's often a direct link to parental mental health and the impact that has on the children you work with and the parents you work with, the way that things like substance abuse and mental health can often be interrelated, that fact sometimes physical abuse and therefore liaison with other agencies, potentially social services, can be part of the picture. And that issue around kind of bullying and the impact of that on well-being and mental health, and how you address bullying in your school, how PSHE comes into that, how advocacy within the school comes into that, hopefully starts to get us thinking about the kind of complexity and the holistic way that we need to think about mental health in schools. So I've just drawn up a few more statistics from a survey that we did this year with the National Association of Head Teachers. Now, I'm sorry to say these are all primary school statistics, but they'll give us a picture, of course, across the age range. So, interestingly, of the few hundred schools we surveyed nationwide, 2/3 of English primary schools actually didn't have a counsellor based on site, and of those without a counsellor, 77% said that financial constraints were a barrier, and 42% said a lack of relationships with health services and knowing how to access counsellors was an issue. I was also struck with of those who didn't have a counsellor, 40% of those didn't provide any kind of PSHE lessons or kind of wider school education around mental health. So there are possibly some schools where there is a real lack of mental health provision. So the question I wanted to pose is, what do we actually mean by a whole school approach to mental health? So at Place2Be, we use the phrase a lot. We talk about how we provide a whole school mental health service in schools, and it is a phrase which the DfE use and is being used more now, but which can be quite hard to actually kind of pin down what that means. So I pulled off one quote from a website which said that a whole school approach to mental health is a multi-component strategy that incorporates, motivates and empowers the whole school to promote mental well-being and tackle mental health issues. Which I didn't think necessarily actually told us a huge amount, but it's basically talking about the fact that we're looking to work with the whole school. So I just pulled off a few bullets of kind of of what it means for us as an organisation. So it very much means that we're thinking about prevention as well as intervention. So not just targeted work for those children and young people that we're already seeing a noticeable well-being or mental health issue, but thinking about how do we build the resilience of children and young people, how do we possibly prevent issues developing. So obviously children and young people, they're going to face adversities in their life, but when you think about the risk and resilience factors they have in their life, how can we increase their resilience factors? That kind of leads on some of the next couple of points. So if we drop down actually slightly out of order to the third, how do we encourage discussion around mental health and wellbeing in school? How do we destigmatise it as an issue? How do we make sure that those conversations are inclusive? So obviously one way to kind of build resilience factors in young people is to enable them to build networks, to encourage them to seek support when they need it, to let them know what avenues of support are available to them. One thing that we do as part of our Place2Be's service is we make sure that there's a self-referral route for young people, so a universal service we would call it, as well as targeted one-to-one or group counselling. So in the schools we work in, there's a service that we call Place2Talk. How children self-refer to that will look slightly different depending on the age range in the school, but typically with the primary age range, we'll have post boxes and slips where children can draw a picture or write their name or write a short description of why they want to see the main school counsellor. They drop that in the post box, and the school counsellor every day they're in school sifts through them, maybe speaks to class teachers if they need to, inclusion managers, etc. And then they make appointments with those children depending on the demands, the priority, the level of need, either that day or another day soon. So that's a way that children can flag up that they want to talk to someone. In our primary schools, that's very, very widely used, so about 40% of children will use that in a school year. And it's used to talk about everything from friendship issues to significant changes in their life. And that can lead to longer term one-to-one counselling. Lots of schools have different ways of having some kind of a universal system. So often it will take place in lunch times, break times, before school, after school. But it's about those children and young people knowing who they can speak to and when and how they access it. To kind of jump up to the second point, so we think of a whole school approach to mental health as being one which isn't just about working with children, it's very much about working with parents and about working with staff as well. So when we're thinking about working with staff, that is both thinking about how do we offer development opportunities to staff so they feel more confident talking about wellbeing and mental health, they feel more confident potentially teaching about it, they feel more confident recognising issues, they feel more confident in building a relationship with potentially vulnerable young people. But also, what about staff wellbeing? So who can staff talk to about the impact of their work with children and parents, and also potentially some of the other stresses and strains that come with the teaching and education profession. So this is just a model really of how one way of visualising how Place2Be approaches a whole school counselling service, and it incorporates, I hope, what we've just spoken about. So we do work with parents. We have we need consent up to certainly the end of Key Stage 3 for our work with young people, the one-to-one and targeted work. But we also want to work with parents to engage them, to get to understand better how things are at home, how their relationship is with their child, and to give them a space to share and hopefully to build their empathy for their child's needs and maybe some of their understanding and skills at coping with what those issues might be, whether it's anxiety, self-harm, depression, all the kind of the terms that we'll be used to. But also it's thinking about supporting parental mental health and being able to signpost on to other services where appropriate. With our work with children and young people, it's about both having targeted counselling, which might go on for 6 weeks, a term, possibly quite a bit longer with younger children, but also a self-referral service. So as much as capacity allows, young people can self-refer and access themselves. It's about working with teachers, and then it's very much about being able to demonstrate impact of what we do. So how do we evaluate the work of our counselling? Our main outcome tool we use is Goodman's Strengths and Difficulties Questionnaire, which is a tool which CAMS and other services use. But there's obviously a whole range of different ways you can try and evaluate the impact of a counselling service, which is good both for people who are funding that. It's good for the people who are assessing your school, but it's also really important so we can talk within the school about what benefits, what changes are we seeing as part of this counselling service. We really want, whilst recognising the confidentiality of some of the work, we want to be able to share that usefully amongst other pastoral staff, with their teacher. And that's why, as much as possible, we want to be part of inclusion meetings. We want to be part of those ways of thinking about children. Suffice to say, the way that we link in around safeguarding issues is obviously paramount as well. I was just jotting down a few things for those schools that don't have, it's just a brain dump, for those schools that don't yet have a counselling service in your school. What are some of the things that you might want to think about? So obviously you want to think about how you recruit your counsellor. What are you looking for? What kind of qualifications or accreditation might you look for? Where can you use other people who've got experience of recruiting counsellors or therapists to help you with that? How will you assess young people's needs? How will you measure the difference that work has? As I've just said, how do you communicate those changes within the school? Where will the work take place? Who will supervise the counsellor? So counsellors need clinical supervision, as many of you will know. And as I've said, what support will there be for staff? What support will there be for parents? How will children access those services? And how might you want to empower children and young people in your school to support other children and young people in your school? Because of the many surveys that are done, particularly teenagers will often say that the people they first go to when they need support is their peers. So although specialist services are great, how can we also empower other children and young people to feel better able to support their peers? I'm just going to try and show a quick video, which isn't too much of a plug for our services. I hope it is 4 head teachers talking about why they use Place2Be in their school, and it flags some of the ways in which a school counselling service can be of benefit.
The biggest difference that Place2Be makes is the children feel safe and they have an avenue to go and talk to somebody if they have worries of any sort about any topic. We teach them how to read and write. We also teach them how to be emotionally intelligent.
So it just means that children are learning for life how to sort out their arguments, how to sort out their problems, and to understand their emotions much more, rather than fighting on the playground and getting very upset and it really impacting their learning for the rest of the day.
I think it gives an opportunity for children to be heard, and whatever their concern might be, whether it's very small or something very significant in their lives, they can talk to somebody about it.
It's consistent in its approach. It's clinically proven in what it does.
And having Place2Be means that my children in my school have the hope of reaching their potential. When they have traumas, there's somebody there to help them so that we can concentrate on the education of the children.
It's such an amazing part of your toolkit in school that we have not had a permanent exclusion since having the project. The children are happy and safe, and they say that's what makes them feel safe in school.
Okay, so I'll just bring back. So that's it. Apart from I wanted to open out for questions. There's 2 images there just to show in a primary school, and I realise some of the content has been primary specific, but an idea of the kind of post boxes we use for the self-referral slips to give you an idea of what one of our counselling rooms looks like. You see there's lots of creative materials which we use in our work. Also, whilst we have any questions, I just thought I'd put up a few other resources which sprung to mind. So MindEd, I believe, is free to access a lot of good educational resources around young people's mental health. Child Bereavement UK is an organisation we've worked with. They do some very good training. They have a helpline. They have e-learning modules, particularly around responding to bereavement issues in your school. I think this month the PSHE Association has released guidance on preparing to teach about mental health and emotional well-being. Young Minds is probably the biggest national advocacy organisation around young people's mental health. They have good links on their website. And finally, we're part of something called the Heads Together campaign at the moment, along with Young Minds and 4 other young people's mental health charities. So you might find other resources on there.